my name is Samantha Peterson. I am the CNA Instructor at the Villa Maria Health and Rehabilitation Center in Hurley, Wisconsin. Today we are going to be talking about infection control techniques with an emphasis on hand hygiene. So infection control techniques are important to protect yourself, your family, and clients. Germs are everywhere. Some are harmless, even necessary for our body, while others are harmful. Germs live in a place where they can grow and increase, usually humans, animals, and bugs. These are called hosts of the germs. Germs leave their hosts through breathing, urination, sweating, intestinal, or reproductive tracts, openings in the body. Germs exit through cuts in the skin and blood. Then the germs travel to search for a new home transmission. While waiting for a home, they may sit around on clothing, furniture, desktops, or virtually anywhere until a new host picks them up. So standard precautions. Standard precautions are aseptic techniques we use at all times to prevent the spreading of germs. Standard precautions mean treating blood, body fluids, non-intact skin like abrasions, pimples or open sores, and mucous membranes, linings of mouth, nose, eyes, rectum, and genitals as if they were infected. Body fluids include saliva, sputum, mucus coughed up, urine, feces, semen, vaginal secretions, pus, or other wound drainage, and vomit. They do not include sweat. The best practice when it comes to standard precautions is to assume everyone is infected with bacteria or viruses. We also use standard precautions to prevent nosocomial infections, which are infections contracted in a nursing facility or hospital. Today we are going to talk about hand washing and hand hygiene. The CDC has defined hand hygiene as washing hands with either plain or antiseptic soap or water, or using alcohol-based hand rubs. Alcohol-based hand rubs, often called hand sanitizers, include gels, rinses, and foams that do not require the use of water. These have proven effective in reducing bacteria on the skin. However, they are not a substitute for proper hand washing. When your hands are visibly soiled, they should be washed using antimicrobial soap and water. Antimicrobial agents destroy, resist, and/or prevent the development of pathogens. Once hands are clean, hand rubs can be used in addition to hand washing anytime hands are not visibly soiled. It is important and expected that nursing assistants wash their hands at this time, when first arriving to work, whenever hands are visibly soiled, before, between, and after all contact with residents, before putting on gloves and after removing gloves, after contact with any bodily fluids, mucous membranes, non-intact skin, or wound dressings, after handling contaminated items, after contact with objects in the residents' rooms, before and after touching meal trays and handling food, before and after feeding residents, before getting clean linen, after touching garbage or trash, after picking anything up from the floor, before and after using the toilet, after nose blowing or coughing or sneezing into hands, before and after eating, also after smoking and before leaving the facility. So the hand washing procedure consists of 8 steps. So the 8 steps to proper hand hygiene is: number 1, turn on the water at the sink and keeping your clothing dry, meaning rolling up your sleeves and keeping your shirt away from the sink. 2, wetting hands and wrists thoroughly. 3, applying soap to the hands. 4, keeping your hands lower than elbows and fingertips down. Lather all surfaces of wrists, fingers, and hands using friction for at least 20 seconds. Some like to sing the birthday song because that lasts usually longer than 20 seconds. 5, cleans nails by rubbing them into the palm of the other hand. 6, rinses all surface of hands and wrists, being careful not to touch the sink. 7, uses clean, dry paper towel to dry all surfaces of hands, wrists, and fingers. Dispose of towel without touching waste container. And 8, use clean, dry paper towel to turn off faucet, then dispose of the paper towel without contaminating hands. So now I'm going to show a demonstration to Adam on how to do proper hand hygiene. So we will go to the bathroom. Can you see? Okay, Adam turns the water on and make sure his sleeves are rolled up. Wets hands and wrists thoroughly. Applies soap to hands. Keeps hands lower than elbows and fingertips down. Lathers all surfaces of wrists, fingers, and hands using friction for at least 20 seconds. Cleans nails by rubbing them in palm of other hand. Rinses all surfaces of hands and wrists, being careful not to touch the sink. Uses clean, dry paper towel to dry all surfaces of hands, wrists, and fingers. Disposes of towel without touching waste container. Uses a clean, dry paper towel to turn off the faucet, then disposes of the paper towel without contaminating hands. And there you have proper hand hygiene.